Hi there, you're welcome to Dami RX Care channel today. Thank you so much for checking us out for your medication needs today, and we would love for you to be a part of our community here at Dami RX Care. In order to do that, make sure you hit that like and subscribe button down below, and also you can check out our free recipe to one of our diet plans here at Dami RX Care by clicking on the link below, and it will direct you to how you can download that recipe for that diet plan that we do have on our website. Thank you so much for checking us out again, and please stay tuned. And today our medication of choice is Norethindrone as well as the ethinyl estradiol. So this medication also comes in 3 different brands, which is Necon, which is Necon, as well as Ortho Novum, and as well as Nortrel. So this medication are used as contraception, and it usually contains about 1 milligram as well as 0.035 milligram of the estradiol. So this medication is taken as 1 tablet a day, and usually it comes in about a 21-day pack as well as a 28-day pack. So with this medication, you want to start it on the 5th day of your cycle. So with the first day being the first day of your menstruation cycle, which is the first day you see your menstrual period, and the 5th day is when you want to start this medication. So day 5. All right, so what are the adverse effect or side effect of taking this medication? So this medication side effect can cause acne, it can cause abdominal cramping, it can also cause anorexia, it can cause nausea and vomiting, swelling, most especially in the lower limbs, as well as an unusual tiredness, fatigue. A serious side effect of this medication can be blood clots. So usually if you have a history of blood clot, this medication is not going to be used for those kind of patients, as this can increase the risk of blood clots. Also, another serious side effect that you want to report to your doctor is a severe lower abdominal pain, or maybe a severe leg pain. This might be a sign of a blood clot in your legs. So you want to make sure that you report this side effect to your doctor as soon as possible. Another common side effect of this medication is ectopic pregnancy. So this is when the pregnancy start developing in another area of, the woman's, reproductive organ other than the uterus where the baby is supposed to develop. All right, and also in patients that start noticing any fluid retention, you want to make sure that you're reaching out to your doctor, as well as any abnormal changes in your behavior. Maybe you start feeling depressed. You want to make sure that you're reaching out to your doctor as well. So, as I was saying earlier, there's some category of patients that cannot take this medication. So, these patients are patients who have a history of stroke, patients who have a history of blood clots, patients who have a history of an abnormal genital bleeding. Also, patients who are pregnant cannot be on this medication, as well as patients who have a liver tumor, breast cancer, or liver disease. So this medication is not recommended in that patient population. So let's dive right into other things that you need to know about this medication. So as I said earlier, this medication is used as a contraceptive. So it is not in any way going to protect from any form of STDs. So you want to make sure that you're using other protective methods if you are sexually active. Also, this medication can cause breakthrough bleeding. So which could mean you start seeing bleeding, during random times of your menstrual cycle. So you want to make sure that you're holding on to like a menstrual pad, or wearing pant liner quite often. That way, if it happens all of a sudden, you're able to get everything together and, find help, or able to, grab your pad and just go to the bathroom and just change. And usually the breakthrough bleeding will occur maybe through the first few months of you starting this medication. Also, usually in patients that when they first start this medication, they may miss their period within the first month of starting this medication. So if you're missing your period for more than 2 months or so, then you want to make sure that you're reaching out to your doctor to make sure that you're not pregnant. Also, like I said earlier, you want to start this medication on the 5th day of your menstruation. So let's talk about how this medication actually works. So the medication works by actually thickening your cervical mucus. That way the sperm is not able to penetrate and fertilize your ovum in order for it to develop into a baby. Also, it kind of slows down the movement of your ovum through the fallopian tube into where it is actually fertilized or implanted. And also, this medication can alter the endometrium in order to prevent implantation. So in other words, it kind of alters your hormones in your body to be able to help it not prepare to have a baby or prepare to develop another, fetus. So in patients that are taking this medication, like I said earlier, you want to make sure you're starting on your 5th day. Also, in the first 3 weeks of starting this medication, it is recommended that you are using another preferable method of birth control. That way, you're fully protected from having, another baby or having a baby. Also, this medication may not be taken in patients who are breastfeeding because of the estrogen content in it. You may ask your doctor if this medication is appropriate before starting this medication. Also, you want to make sure that you're contacting your doctor if you start noticing any breast lumps, if you start noticing any severe aches, headache, maybe like a chest pain, as well as, swelling in your lower limbs or different areas of your body. Also, in patients who have been diagnosed with diabetes or who have been diagnosed with pre-diabetes, you want to make sure that you're checking your blood glucose regularly. That way you're making sure that this medication is in no way affecting your blood sugar. All right, so I hope I was able to help in 1 or 2 ways on what to look out for while taking this medication. Make sure you check out our free recipe for one of our diet plans down below once you hit that subscribe button. Thank you for watching and stay tuned.